Okay, good morning, everyone. We're going to go ahead and get started today. Can you please take a look at your screens and make sure that you're muted? That would really be helpful. Thank you. We're pleased to have you join us today for our first of hopefully many annual trainings regarding mental health screening. Just a few items before we get started. If there's one thing I have learned in this world of virtual interactions, it's the inevitability of technology at times going awry. So we ask for your patience as we try to navigate any technological issues that may arise today. A reminder again to limit interruptions to the presenters. Please make sure you keep your microphones muted for today's training. Just to help make sure you're in the right place, today's training is required by statute and board rule for any and all LEAs doing mental health screening. In today's training, we'll cover the purpose of school-based mental health screenings, including background information and how we got to where we are today, key terms and definitions, requirements set forth in statute and rule for mental health screenings, best practices for mental health screenings, and resources to help guide your planning and implementation. Just want to quickly introduce the team. My name is Tanya Albornoz. I'm a prevention specialist at the Utah State Board of Education. And I'm also a clinical social worker. I came over recently to USBE from child welfare, where I worked for 20 years. And let me turn it over to Scott so he can introduce himself.
Thanks, Tanya. My name is Scott Ayer. I work for the Division of Substance Abuse and Mental Health, and I am the school-based mental health specialist that acts as a liaison between our agencies with the Board of Education and the division. Also sit on the School Safety Center and I'm an active member there. So, and then Michelle, is she with us, Tanya?
Yes, I am. Thanks, Scott. I'm Michelle Knight. I'm the Project Aware Grant Manager at Utah State Board of Education. Previously, I worked with Safe UT, so I do recognize quite a few of your faces. And welcome. I'll pass.
Thanks, Michelle and Scott. Just give me 1 second. So, as you listen to today's presentation, we ask that you think about your program and some ideas or practices that you can implement to improve your program. At the end of today's presentation, we'll ask you to identify some areas of improvement for your mental health screening program and possibly share those ideas out with the group. We'll also be providing some time for LEAs to connect with each other, ask questions, and share best practices, especially for those of you who have been doing this process for a while. We'll give you time to collaborate if you're sitting together with your team and help each other as peers in this work. As we move through the presentation today, we ask that you hold your questions until the end, but we do want you to be able to post those questions in the chat. We have time built in at the end of today's presentation for question and answer. And we'll also make sure to review all the questions that you've posted in the chat and make sure that you get the answers that you need. So once again, if you could hold your questions or post them in the chat, we'll make sure to get those answers for you. Please note that because statute and board rule requires LEAs to participate in this training in order to conduct mental health screenings, we have created a short quiz to verify attendance and material comprehension. The quiz will need to be completed by at least one person in each LEA. For those who are not here and might be viewing this at a later time, this will also help to verify your attendance and comprehension. We also ask for understanding and patience as this is a new program. We're finding that there are many nuances that need clarification, including legal clarification. Statute and policy are not clear on some of these complicated issues, and it sometimes takes some time to make sure that we get accurate legal interpretation. So also as laws change, like right now we're in the middle of a legislative session, sometimes legal interpretations do as well. So please be aware that there may be changes to this information in the future. It's a good idea to make sure that you are attending the annual training and checking with us as a mental health screening team at USBE on questions so that you have the most updated information. Okay, so let's talk about why we are here today. We know that we all have one shared purpose and goal, and that's to connect schools and mental health organizations for the benefit of students and families. We know that we live in a unique time in history that provides a multitude of challenges for students. We also know that students benefit from early diagnosis and treatment of mental health concerns, and that schools are the first line of defense in identifying and treating students with mental health concerns. We also know that academic achievement and mental wellness or mental fitness go hand in hand. It's hard for students to achieve their academic potential when they're suffering from depression, anxiety, or suicidal ideations, or other mental or behavioral health issues. We want to be able to identify and provide resources for those students and families who need support for possible mental health concerns. At the core of all of this work, our purpose is really prevention. Prevention is the ultimate goal. We know that there's a large body of research and evidence that school-based mental health screenings can be critical to detecting emerging mental health conditions, connecting youth and their families to appropriate supports that can provide early intervention and treatment can reduce or prevent more serious issues from developing in the future. In this way, we can benefit our students, our families, our communities, our schools, and ultimately, the goal is to benefit society. So just a few quick stats to help drive this point home. And these are Utah-based statistics. So the National Survey of Children's Health that's done every year showed that 1 in 5 children in Utah have mental, emotional, developmental, or behavioral issues. So this survey was the 2018 and the 2019 combined data. And basically the number is 22% of our kids exhibit mental health issues or are at risk for negative outcomes. So 1 in 5 children in our classrooms are exhibiting these issues. And only 55% of children in need of treatment are able to access care for a mental health provider. Some of the barriers for our students and families, as you know, are lack of providers in your area. It could be that they have to travel long distances or be placed on long waiting lists to receive care. The cost of treatment, as well as a lack of insurance coverage, and the time and effort involved for families to be able to navigate those systems and those complexities. There's also a lack of awareness. Parents don't know how to access the system. They need someone to help them. And there's also the problem of entrenched stigma associated with mental health. Many people are embarrassed or ashamed of these issues and are reluctant to talk about them. So if we look at a performance audit that was done recently by the Utah Legislative Auditor General report in 2019, it showed that $9.5 million is spent every year in the state of Utah on suicide and mental health crisis services. So ultimately our goal is not only to help decrease that number, but also to increase the benefits to our students and families in Utah and to help those students and families access the needed resources. This is a rather large number, and this is the find of what it costs the US in untreated mental illness every year. This number was published in 2012. So $100 billion in 2012. I don't know what that translates to today, but I'm guessing it's even larger number. It's actually kind of mind-boggling. Some of the costs that this is associated with is chronic illness, academic failure, substance abuse services, dropout, school dropout, family dysfunction, interaction with the juvenile justice system and the criminal justice system. Mental health concerns also create a tremendous amount of human and economic cost for children, family, and society. So again, this is one of the reasons why we're here today and why we want to make a significant difference in our system for these students and families. So just some background about how we got here today. So during the 2020 Utah legislative session, House Bill 323 was passed by the legislature. It was sponsored by Representative Steve Elison and Senator Ann Milner. The bill set standards for participating LEAs to implement approved mental health screening programs for students and gave authority for USPE to make rules to govern mental health screening in schools. This includes identifying the mental health conditions that will be screened, the tools that can be used for screening in LEAs, It provided that LEAs would attend an annual training, which is what we're doing today, and a process to approve LEA screening programs submitted by LEAs. The bill also prohibited mental health screening from occurring in schools without parental consent. It requires USBE to work with the Division of Substance Abuse and Mental Health to approve mental health screening tools and provided data privacy guidelines. It also established that USBE can distribute funds to LEAs to assist parents to pay for resources needed to address a potential mental health condition that was identified during screening. Most of those provisions can now be found in Section 53F to 522, and we'll provide you with that link at the end of today, and you can also find that link on the Safe and Healthy Schools website. Can I just ask that participants one more time look and make sure that you're on mute? That would be great. Okay, so once the bill was passed through the legislature, the Utah State Board of Education was required to make rule to clarify and provide guidelines to LEAs on how to put this into action. So the board rule required for mental health conditions, required the board to make a list for the mental health conditions that could be screened. It also provided that USBE will maintain a list of pre-approved mental health screeners, provided guidelines for approval of LEA mental health screening programs, clarified data privacy considerations, and also the requirements for providing those parents with financial assistance that need it. That portion of the rule and the statute that we provide financial assistance is an optional piece for LEAs. It's not something that you're required to implement. Schools are not, I also want to clarify that schools are not required. Schools are not required to conduct mental health screening. However, any school that chooses to do this needs to be in compliance with all the requirements in the statute and the rule. Okay, so I'm going to turn the time now over to Scott, and he's going to talk to us a little bit about how we got to where we are today and some more about the definitions.
Thank you,
Go ahead, Scott.
Tanya. Yeah, I just want to pick up with where Tanya left off and just briefly say thank you. I know that this is a required training, but it's also optional work, and thank you for engaging in it. I think it's important, as Tanya highlighted, that we work to increase and improve upon our mental health supports for our youth across the state. Screening is a big piece of that puzzle, and you know, in the room today, we have folks that are entering this work or engaged in this on different levels of implementation. It's also important to recognize that this is the board's first attempt and Utah's first attempt of offering rules and guardrails around this work. And it's exciting to see that there's even some financial support behind this as well. So this is a good step forward, I believe, for us. And in today's presentation, we want to give you some technical support pieces that need to be considered within those rules. You know, pieces of the grant process or reporting or those things, but also some best practices to consider when conducting school-based mental health screening. And one place where we always like to start is with the data. So let's start with some of those data pieces. Okay, so we know that the prevalence of mental health concerns with our youth population remains high. If you want to go back to that slide. And what we found out in our 2020 school safety survey is we learned that most administrators, the majority of administrators out there, were concerned about the academic delays and mental health concerns that their students were facing, especially in light of the pandemic and some of the other concerns that really were brought upon us in 2020. Also, the top 3 risk factors that were increasing during that time were anxiety, stress, and social isolation. We also, during 2020, looked at our data pieces for our screening practice survey and got feedback from the field. And what we found out is that 69% of schools were already conducting mental health screeners on some level, and that there's a majority of schools that also were interested in engaging in that work. Of those schools that reported, the leading conditions that schools were interested in screening for were anxiety, depression, and suicidal ideation. And so hopefully this gives you some insight into how we've arrived where we have today, and really some of the decision-making process behind the scenes. Also, when implementing your own mental health screening in your schools, it's important that you start with the data and ask yourself what data points are from your local area, both qualitative and quantitative, that you can use to really help influence how you implement your mental health screening efforts in your schools. Let's go to that pop quiz, Tanya. So I know we got some teachers, maybe some ex-teachers in the room, and I know how much you guys like pop quizzes, so we were going to include one today. It's really easy. Just drop your answers in the chat. And we'll start with number 1, asking you to answer a term that includes your emotional, psychological, or social well-being. Affects how you think, feel, and act. Is that behavioral health? Is that your overall well-being? Maybe it's your physical health, mental health, or hopefully you don't need to phone a friend. And this is not the quiz that is required, but if you get this wrong, Tanya, maybe we'll hold some people after if we need to. I'm just kidding. Good, I see that chat blowing up. Okay, a term that includes our emotional, psychological, and social well-being. Tanya, what's the answer? Good, I saw a lot of D responses in the chat. Perfect. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, act. It also helps determine how we handle stress, how we relate to others, and make healthy choices. A person can experience poor mental health and not be diagnosed with a mental health illness. Likewise, a person who is diagnosed with a mental health illness can experience periods of physical, mental, and social well-being, according to the CDC and mentalhealth.gov. All right, let's go to question number 2. Question number 2. What is an umbrella term that includes substance abuse, mental health, psychiatric, marriage and family counseling, and addiction services? Again, drop your answers in the chat for number 2. Tanya, if you want to reveal the answer. All right, awesome. Behavior health. I saw a lot of you get that right. So behavior health is an umbrella term, which includes substance abuse, mental health services, and as a discipline, behavior health refers to mental health, psychiatric, marriage and family counseling, and addiction treatment. It also includes services provided by social workers, counselors, psychiatrists, neurologists, and physicians. It encompasses a continuum of prevention, intervention, and treatment and recovery services. So it's important to remember that for this training and for what we're talking about today, we're really staying within the lane of mental health. We can look at that next slide. I also want to talk about some of the key definitions and distinctions between screening, assessment, and diagnosis. Now, it may be helpful to understand that this is a process that takes place in other areas of our lives. It takes place in the medical world. We'll see it in academics as well. Even, you know, your vehicle will have this process when there's an issue that may be presenting itself. So screening is defined as the process for evaluating the possible presence of a particular problem. Assessment would be the process for defining the nature of that problem, determining a diagnosis, and developing specific recommendations for treatment of that problem or diagnosis. So if we back up just a little bit, we want to screen in order to make sure that we're looking for those key indicators that may require a further assessment. And then if that assessment is done, and within that assessment, a diagnosis might take place, and that is the process of using assessment data to determine if the pattern of symptoms that the individual is presenting is consistent with the diagnostic criteria for that specific mental health disorder set forth in an established classification system such as the DSM-5. And diagnosis is something that is done by those that are licensed clinical professionals. So again, for this training, I want to make sure it's very clear that we are also staying in the lane of screening, and that's what we'll be talking about today. Okay, a few more definitions just for clarification on the conditions that LEAs are approved to screen for in compliance with the board rule are anxiety, which is defined as the apprehension, uneasiness, or nervousness, or abnormal and overwhelming an overwhelming sense of apprehension and fear. So our screeners that are on the list are really targeting those things. We're looking for those things in that screening process. Depression would be screening for states of unhappiness marked by inactivity, difficulty in thinking, concentration, significant increases in or decreases in appetite, times sleeping, and also feelings of dejection and overall hopelessness. And suicide ideation, this refers to thinking about, considering, or planning suicide. The last definition and the last clarification that I'll make is on the next slide with what a mental health screener is. This is taken directly out of our board rule, I believe, or maybe it's statute. It looks like statute. A mental health screener is a systematic tool or process that is used to identify if a student is experiencing or at risk of experiencing issues related to that student's mental health. It's also used for early identification strategies to detect the onset of mental health conditions and enabling that mental health condition to potentially be addressed or treated. These are tools that are not diagnostic tools. Again, these are screening tools. They are not diagnostic. And they are also not a part of a system or process used by teachers to observe behavior for the purposes of targeted learning interventions. So again, this is where screeners are defined of what they are and what they are not. Tanya, I'll hand it back to you.
Thanks, Scott. Okay, I'm going to talk about what the requirements of mental health screening are, the mental health screening programs are that are set forth both in statute and in the board rule. So if you have any questions on this part, again, please make sure to drop those in the chat so we can make sure to address them at the end. So the first thing is that every LEA that's conducting mental health screening is required to inform USBE. We did this through the participation application in December, and it is going to need to be done every single year. What the rule states is that LEAs will inform USBE every year by May 1st for the following school year. So the participation application will reopen. We'll have a process where that reopens every year, every spring prior, obviously prior to May 1st, so that LEAs can make sure to inform USBE about what their mental health screening program is doing. Secondly, again, you must use one of the pre-approved screeners on the pre-approved list that's the USBE as designated as an approved mental health screener. That list is found on the Safe and Healthy website, Safe and Healthy Schools website, and we're going to make sure to update that as changes are made to the list. Now there has been quite a few LEAs that have approached us and have asked for us to, or have requested approval for a screener that's not currently on the list. There's a process that we have to go through in order to get those screeners approved, but the questions that you'll need to fill out for us if you want a screener to be on the approved list are on the participation application. So when you fill out that participation application, if you know that you're going to be requesting a screener that is not currently on the pre-approved list, just make sure that you have that information and fill out that information so we can take those requests to the board for approval. Let's see. So the information that we're going to request includes the name of the screener, the recommended ages for the screener, any limitations, including false positives, mental health conditions that the screener can detect, a link to the evidence-based data on this or the screener's website. We also have to ask who can administer the screener. And so all of those questions will need to be answered so that we can take those to the board to get an approval on that specific screener. Another requirement of the mental health screening grant is that all LEAs attend the training provided by USBE and the Division of Substance Abuse Mental Health, which is today's training. Just know that this will be a training that occurs annually, and we'll probably be giving this training or a version of this training again at the early part of next school year. There are also set forth in statute and rule specific data reporting requirements, and LEAs are required to report annual aggregate data to USBE. This includes the type of mental health interventions, referrals, and other actions that the LEA takes based on the results of the screener as you provide those screeners to students. So make sure that you're collecting that data in a way that you would be able to report that out to us at the end of the year. The last thing is that there are both data privacy requirements and parental consent requirements that need to be followed in order to do mental health screening. LEAs need to ensure that data collection complies with all state and federal privacy laws. And also you have to make sure that you provide parents with a list of all data collected by the screener on your consent form, as well as a list of everyone who has access to the screener data. So these are requirements set forth in the statute and the rule. You also have to provide parents with the results of the screener, the resources applicable to the student due to the result of the screener, and then the statute and board rule also state that the data can be shared with the school's multidisciplinary team. So if you have a multidisciplinary treatment team or planning team for students, you can share that data with that team. And the data needs to follow a 3-year retention schedule. I'm now gonna discuss the parental consent requirements on the next slide. There are specific parental consent requirements that are set forth in the statute. Parental consent needs to be obtained within 8 weeks prior to administering the mental health screener. So you need to make sure that you have a signed dated parental consent form that's within that 8-week period. The statute also states that it has to be a separate consent form. The consent form for mental health screening cannot be combined with other consent forms. It has to be a standalone consent form. And then there are specific elements that the form must include. And that is that which board approved mental health conditions the screener is measuring, additional variables that might influence the screener results, a statement that the screener is optional and not a diagnostic tool, a statement that the parent has the right to seek outside resources and opinions, and a list of all data potentially collected by the screener. So these are the requirements for the parental consent form. Please make sure that your consent forms include all of these points. It's also best practice, just to mention, it's really best practice to make sure that you have a way to discuss the results with parents and make sure that they understand that this is just a screener that tells you that you need to dig a little bit deeper and maybe do a further assessment for these mental health conditions. And then lastly, Parental consent must be obtained regardless of the age of the student. We've received several questions asking us about 18-year-old students or students who may be older than 18. And we just want to clarify that we've received the legal interpretation that because of the way the statute is written, all students, regardless of age, need to have a parental consent form in order for you to do mental health screening. Okay, a few other clarifications. Universal screening. I've had many questions come to me from LEAs not understanding what is meant by the term universal screening. Universal screening basically means that the screening will be offered to all students. It's not that you'll conduct screening with all students. It doesn't also apply to the actual screener itself, but it refers to the opportunity to be screened is offered to all students. Universal screening also does not mean that LEAs pre-identify students to participate in the screening that have specific concerns. The decision really is left up to the LEA on how they wish to operationalize the implementation of mental health screenings within their schools, meaning you can choose if you want to offer it to specific grades or classes only, or if you want to make the opportunity available to all students. We've also had questions about what constitutes a mental health screener. And we just want to clarify that any screener that includes questions specific to anxiety, depression, or suicidal ideation fall under this rule. So if a screener includes those questions, make sure that if it includes any questions on anxiety, depression, or suicidal ideation, it has to be on the board approved screener list. And the reason for that is the board wants to ensure that if questions are asked about those conditions, that the LEA also has the right supports in place for that student and family. Also, the purpose of the tool is if the purpose of the tool is to determine whether the student may have mental health conditions that require interventions, even if it does not require the active participation of the student, so it's relying on observations of the student, then it also falls under the statute and board rule. So if you have a process where someone is observing the behaviors of a student and marking things off on a checklist, that also falls under the statute and board rule. Next, the participation application. We've already kind of discussed how that's going to be required from going forward for every school year. You'll have to provide that notification, and you'll have to provide to us which pre-approved screeners that you'll be using. And again, that process is to apply for a screener that might not be on the approved list. So we've also had some questions come to us about what is it a mental health screening? And we've had some discussion about, is it a screening or is it assessment or is it crisis intervention? You heard Scott discuss these definitions a little bit earlier in the presentation. But we just want to mention that screening really means that the intent of the mental health screening is to oversee universal general screening for students. This happens when students and parents opt in to mental health screening or when the student may be exhibiting some concerns that give rise to a suspicion of an underlying mental health condition, and the parents provide permission for the student to be screened. In general, these symptoms are not generally intense or extreme in nature, but they may still lead to a concern about the mental well-being of the student. The reason for providing a mental health screening is really, again, like Scott said, to determine the possible presence of a mental health condition and to determine if the student may benefit from a referral for treatment. If an LEA is providing this type of screening, then the mental health screening participation application is required. However, if the LEA is intervening with a student due to an infraction or because of identified behaviors or concerns that are ongoing or chronic or increasing in frequency or duration, and the school has already determined that there's a need for some type of action, then this is considered an assessment. And that's because you're basically skipping over the mental health screening process and going in already determining that there's an issue that needs to be addressed. The other issue is crisis. If you're intervening because of the intense behaviors of the student and those behaviors give reason to believe that the student poses a risk of danger to themselves or to other students, and immediate action is required, then this would be considered crisis intervention. Both assessment and crisis intervention are not considered a part of the mental health screening process. LEAs are not required to use a screener on the approved list for these types of things, not for assessment or for crisis intervention. Also excluded are students that are being assessed for disabilities that may qualify them for an IEP or for Section 504 services. Okay, and psychoeducational testing is also excluded. One other thing that we need to discuss is when an LEA decides to contract out for these services with a mental health provider. So when that happens, there are several things that need to be taken into consideration in order to determine if it falls under the purview of the statute and rule. So here, the things that really need to be considered when you're contracting out is, are the services being provided through a contract, and is funding or resources from the school being provided to supplement the service? Are the services also being provided at the school with the knowledge, consent, and approval of the parent or guardian? And is the service provider, the entity that you're contracting with, providing information or records to the school regarding the results of the screening? If those things are true, then it's considered a school-based mental health screening. And you'll need to make sure that the contractor is following the requirements set forth in the statute and rule. When an LEA decides to contract, it's also the responsibility of the LEA to provide clarity in the contract of how the services will be provided and what requirements that the contractor must follow, including those established in rule. So we know that even though we've said all of this, that there are many factors that need to be taken into consideration, and this isn't comprehensive for all situations, for all LEAs across the state. So we ask that, due to the varying needs of LEAs and also our desire for consistency on the issue of contracting, in order to make sure that you're in compliance with the statute and rule, that you discuss any other situations that aren't covered in these things that we discussed, that you contact the mental health screening team at USBE and let us discuss the situation with you and help you make a determination whether it falls within the purview of the statute and the board rule. Lastly, one of the clarifications or questions that we've received is about supports for parents. So what LEAs want to make sure that prior to mental health screening taking place, you have a plan for addressing any identified mental health concerns, as well as an identified process for connecting students and families with established resources for support. So there should be that process in place for follow-up to occur with the families to ensure that they understand the results of the screening, and that, again, this is just telling the families that there might be an indication that they need further assessment for their student. A lot of these issues are addressed in our frequently asked questions document that we have available on the USBE Safe and Healthy Schools website. There's a link to this document there, and you can go there and see the information. It's always going to be there available for you to hopefully help clarify some of these issues. One last thing is that the legislature also designated some funding for a competitive grant opportunity for LEAs to assist in your mental health screening process. So this is not a required grant, but it's funding that's there to assist LEAs in the implementation or the ongoing services that are needed in order to do mental health screening in your schools. The total ongoing funding amount was $500,000. And the funds can be used for, again, the cost associated with the screening program, or to assist qualifying parents to pay for resources that cannot be provided by school personnel. So in the statute and board rule is information on how parents need to qualify to be reimbursed for these funds. HB 323 and R 277625 really outline what those requirements are. So the grant was released in December and due in January, and that was for the remainder of this school year. And the grant will be re-released again for the 21-22 school year. More information about the grant is available on the website for those who are interested in funds to support their mental health screening program. Now I'm going to turn it back over to Scott so that he can discuss some other issues regarding best practices.
Thanks, Tanya. And I know that's a lot. I know that there's questions in the chat, and also everybody has a very unique set of circumstances. So as Tanya said, feel free to reach out to us after this meeting. Hopefully some of those questions were answered as she reviewed that, but also at the end of this meeting, I think we'll field some of those questions. I think that's the plan for anything that wasn't answered. I want to transition real quick away from some of the technical pieces and maybe start talking about some of the best practices. And I want to introduce this work that's taking place right now. It is the school-based, well, it used to be the school-based mental health, school-based behavioral health implementation guide. Sorry, that's a mouthful. And has been an update that the USBE and DSAMA have been working on in collaboration. And this is something that is historically largely been used by our mental health authorities to help guide them in their work with schools. And what we're trying to do is bridge that world, bridge those two worlds together, and bring schools and community mental health supports into alignment, and do so in a collaborating way. And so this will be available late summer, maybe at the beginning of next school year as that gets rolled out. And it's something that we'll be talking about behavioral health in general, what that looks like in schools and within the community. And it's a great way for us to understand screening and look at best practices within the world of mental health screening in schools. So with that in mind, I just want to draw your attention to the framework that has been established for this toolkit, which is based on SAMHSA's prevention framework, SAMHSA's Substance Abuse and Mental Health Services Administration prevention framework. And this framework consists of 5 stages. That is the assessment stage, capacity stage, the planning stage, implementation, and evaluation stage. And using an established framework is in of itself a best practice to apply mental health screening to. And we'll look through that lens in the next few slides. What I will say is there's also those other components, things like culture, data, collaboration, and sustainability, that are pieces that need to be considered within each of the stages. And so it's important to spend time in each stage in order to make sure that we're really being careful to consider all aspects of the mental health screening process. While I review each stage, really I'm just asking you to maybe reflect back on where you're at personally in your LEA or your school, and maybe some of the things that you haven't considered might pop up for you. There might be gaps that we talk about and highlight, or even some of the successes that you may have run into. And again, I want you to be thinking about that, because I'll go through these pretty quickly and just give a brief 10,000-foot overview. But if things pop up, I encourage you to write those things down as we go through this. Okay, let's talk about the first stage, the assessment of needs stage. Really some key bullet points to be thinking about within this stage are looking at your resources in your area, doing a good resource mapping exercise. Find out, what services, programs, people, materials, what things are available to you. Beginning with this end in mind, we should always be looking for what a successful screening program might look like. Really, what ultimately are we trying to achieve, and how do we clarify those goals? If you're not already writing them down using maybe a SMART goal format or something, you ought to be thinking about that. It's also important for us to be clarifying our goals in a way that is aligning those with the other agencies that we're working with. Very often we make our goals, right? But finding ways to make our goals more universal, and now they're our goals. And beginning with the data, as we presented earlier on some of the data pieces that have helped influence where we've landed today with this work, it's important for you to look at your measures of effectiveness. And what are the things that you know? Are you measuring the right things? And how will you know if you've been effective or not? Some of the furthering questions that you might want to consider during this stage is, what do we hope to accomplish? Where are our strengths and where are our gaps? And who else might we learn from, or who needs to be invited to the table? Moving into the building capacity stage. The first thing that jumps out to me is the training of professionals and bringing in whatever resources that we need to in order to make sure that we're getting the professional development that we need in our area. This may come from outside sources, but it also might come from the experts that we already have in our organizations that can help to share more widely some of that information. Really get into the weeds if you need to on this. It's important that we look to build out our professionals. Partnering, we need to be generating buy-in and support, stepping out of our silos, collaborative work, and being inclusive throughout the process. Who else needs to be included? Again, if you haven't already started to think about that, there's a lot of value bringing additional voices into the room. What is the budgeting? What is the funding going to look like? Looking at your current resources, how to best maximize those, but also I'll throw in a plug for this grant opportunity that's associated with the mental health screener. That's an ongoing $500,000 of ongoing funds, and hopefully, and that's not a lot of money for the entire state, but what I will say is I think it can go a long way, and hopefully we can extend that and ask for more and continue to build out as this becomes effective. And then examining your current practices. What we're talking about with examining current practices is looking at what you're doing within your school climate efforts or SEL or restorative practices. How well are we doing those things, and are there places that we can shore those things up to help the overall efforts? Furthering questions, what outside knowledge can be brought in, what's realistic? I mean, sometimes we're shooting for the pie in the sky and we want to do everything we can, and that's good, but we have to also keep our feet on the ground and ask what is realistic. What or who else do we need to include to accomplish our goals? And are accommodations, or will there need to be accommodations for special populations? Oh, you can go ahead, Tanya. Go ahead. This next slide, planning. Really, it's time to get into the details of logistics. Who does what and when? We need to nail down those specifics and really talk about timeline, budget, materials, rule compliance, really data collection consideration, universal application of the tools, and really overall oversight and administration pieces really have to be thought through at this stage. Format considerations, are you doing this online? I know that there's folks across the state that have done this online or converted their screening process to an online format during the COVID time and have found some success in that. So is that your plan, or are you doing it more of a traditional setting, or is this done during school hours in a different way? Whatever you've decided to do, ask yourself during your planning phase what considerations need to take place, and what do those look like. Referral pathways. When we talk about referral pathways, it is so important to our work that when needs are discovered, not if, but when needs are discovered, that we have a plan to move forward. There's going to be some universal intervention strategies, things that target the population, school population at large, things like school climate adjustments, informing SEL curriculum based on the results of the aggregated data, tapping into restorative practices, even influencing staffing decisions. If you see that there's a great need in a certain area, that you might adjust some staffing to help support that on a universal intervention strategy. And we also know that there's targeted intervention strategies with referrals out, student specific, and connecting them to additional resources. It is never a best practice. Hold on, Tanya, let me go back 1 second. To begin any mental health screening without first establishing a clear plan for responding to discovered needs. I think that is so important. And if I could drive that point home, we want to make sure, and I think the board rule supports this, that if we're asking the questions around anxiety, depression, or suicidal ideation, that we are really making sure that we've thought through the back end and making sure that those supports are in place. Okay, let's move into implementation.
Sorry for being trigger happy there.
You're good, you're good. Implementation, bullet points to consider. I say customer friendly and handle with care simply because the material that you'll be working with, the subject matter that you're diving into, is one that we want to be very aware that it's difficult. We know that it's difficult for folks to access treatment. There's stigma related to that. We hope to cut through that, and we hope to make their experience with the mental health services touches in their life constructive and positive as possible. Also, adherence to the rules during the implementation phase, which tends to be the phase that we all just want to dive right into. We have to keep in mind the rules and the assurance of fidelity and oversight during the process. It's going to be ready, set, go sometimes, and getting caught up in that process, it's important to, again, keep those pieces in mind. And then listening to feedback. There's going to be feedback, post-survey feedback. I'm sure many of you guys are doing pre and post surveys. I think that's a great idea. But there's also feedback in real time, in the moment. How are we adjusting? What are we doing to take that feedback and implement what we're learning in real time? So some of the furthering questions during this stage might be, which again, these are questions that many of you guys are in this stage. These might be, what might this feel like for students and families? Again, pointing back to their experience. Do we have an appropriate oversight? Are we in compliance? And are we flexible and able to adjust as needed? And the final stage, we can go ahead and go there, Tanya. The final stage of this framework is the evaluation stage. This is on the back end. What are we doing with our data analysis piece and taking a look at data and learning what new was discovered, taking those lessons learned and really making adjustments, returning back to the assessment of need stage and inputting those adjustments into our front end in order to refine and continue to work forward in the process. Again, using the data, both qualitative and quantitative in the lesson learned to help drive your programs. Also, keep in mind on the back end the reporting requirements that are in place. And the state does require an annual report. I know there was a question in the chat about that. I believe that that information, Tanya, will be detailed somewhere, and I think we can maybe link to that or make sure that that information gets out.
Yes.
What I do want to do is, I know that there's intervention referrals, and mention some of the screening program results that we're talking about on data reporting is really aggregate data, overall data that we want to make see on a state level. And then some of the questions to be thinking about during this stage is what went well, maybe what didn't go well is, needed to be considered. What do we wish could go better in the future? To whom and how will we share our data? Part of that is if you are collaborating with partners and that data piece is protected by FERPA or HIPAA, we need to make sure that we respect that piece. However, it's great to be talking on general terms on what went well in general. It's great to be communicating thank you to the community for their involvement. That is a big piece of data that sometimes gets overlooked that we shouldn't forget. And whatever we can do to help be inclusive with our data while staying within the lines. And also, how can we help or how can we apply the knowledge gained? And before I'm going to hand it back over to, well, actually, I'm going to give it to Michelle in just a minute here. I just want to remind you that screening is a best practice that's really part of a more overall comprehensive plan and systematic approach to dealing with mental health. So we know the research, and Tanya spoke to that, the results are in. It's overwhelming that this universal mental health screening process aids to the prevention efforts and connects youth and families with the supports they need on the back end for folks that are experiencing emerging mental health concerns. Screening is an important piece, and it does help to support the social, emotional, and academic achievement goals as well. And it's just again a piece that I believe that we're really been lacking in our state, and I'm glad that we're stepping into these waters. And I want to thank you again for all you guys' support and efforts in this. And so, Michelle, I'll send it over to you.
Thank you, Scott. So Tanya, if you want to click the title and I'll get to it. So effective prevention starts with you. Mental health screening allows us to identify students with mental health conditions, as we've reviewed. As Tanya mentioned in the start of this presentation, the reason we are all here is because prevention is the ultimate goal. And understanding the issues concerning suicide and mental health is an important way to take part in suicide prevention, help others in crisis, and change the conversation around suicide. To do this, we want to follow a strategic planning approach for prevention, building off of what Scott has just mentioned. So number one, you want to use data and other sources to understand how suicide and other mental health conditions affect your community and to describe that problem and its context. Number two, you want to identify a small set of realistic and achievable long-term goals. For example, reducing the suicide rate among a particular demographic. Number three, you want to prioritize your key risk and protective factors on which to focus your prevention efforts. A good way to do this is the Strengthening Families approach. It's a research-informed approach to increase family strengths, enhance child development, and reduce the likelihood of child abuse and neglect. It's based on engaging families, programs, and communities in building 5 key protective factors. That's parental resilience, social connection, knowledge of parenting and child development, concrete support in times of need, as well as social and emotional competence for children. Number 4, plan your approach by deciding which activity or combination of activities best address your key risk and protective factors. Number 5, develop an evaluation plan to track your progress towards your long-term goal. and show the value of your prevention efforts and give you the information you need to refine, expand, or determine other next steps for your program. And lastly, number 6, you want to implement and evaluate your activities and use your evaluation data to monitor implementation, solve problems, and enhance your prevention efforts. Now to do this, if you want to click once more, you want to do this by approaching in a strength-based versus deficit-based thinking. Being strength-based suggests that the way we interact and respond to children is rooted in the way we view them. As practitioners focused on promoting resilience in at-risk children, we must maintain a positive focus even when children are being difficult for us to understand. And when children exhibit challenging behaviors, deficit mindsets tend to be more prevalent. So it's a very specific way of thinking. And examples of this, rather than saying, what's wrong with her, you're saying what's right with her. He's just a bad kid versus there's no such thing as a bad kid. And wow, look at their behavior versus I wonder what's making them feel that way or act that way. Next slide. Thanks, Tanya. And you can click. Now that we have an understanding of why we are here, I wanted to review some best practices that were compiled from a few LEAs who have already been implementing mental health screenings. To begin was the referral process. Invite as many of the school counselors from the school that is hosting the event to attend, and that includes the school social workers, school psychologists. We encourage the school or feeder school social workers and psychologists to attend and meet with students in their responsibilities. There are also 13 local mental health authorities that can assist in school screenings and referrals. They are all listed at the end of this as a resource link, as well as on the DSAMA webpage. If you work closely with a behavioral health institute such as Huntsman Mental Health Institute, formerly known as UNI, the Wasatch Behavioral, Provo Canyon Behavioral, Bear River, any one of these, you can invite them for extra supports as well. Click. As Scott's data presented, the top 3 risk factors have increased over the last year. So here are just a few mental wellness strategies. Brighten your outlook, reduce stress, get quality sleep, be mindful, cope with loss, strengthen those social connections as we talked about with protective factors as well. And lastly, when talking to your students or even your own children about mental health conditions, you can ask your kids these questions to kind of start that conversation. Mental health conditions can impact moods, thoughts, feelings, and behaviors, and symptoms can cause enough distress to affect schoolwork, relationships, and hobbies. So if you give accurate information, address blaming and scapegoating, don't focus on methods in cases of attempts of suicide or suicides, address angers, address feelings of responsibility, and promote help-seeking behavior. Next. So in the chat, or feel free to unmute yourself as well, I just want to ask a quick question. Can anyone guess the percentage of 14 to 22-year-olds who research their mental health issues online, specifically searching for celebrity blog posts? I know that's kind of a loaded question. Does anyone want to guess that percentage? 40, 30, 45? Significantly higher, 17, 80. Wow, lots of good guesses. So Miss Tanya, you can click again. The 2020 national survey of 14 to 22-year-olds found that 90% of teens and young adults experiencing symptoms of depression are actually researching their mental health issues online, and most are accessing other people's health stories through blogs, podcasts, and videos, specifically through celebrity blog posts. And this kind of goes to my conversation of stigma. So if you want to click again. So breaking stigma means talking about your mental health. And stigma comes in 3 forms. That's self, public, and institutional. Public stigma involves the negative or discriminatory attitudes that others have about mental illness. Self-stigma refers to negative attitudes, including internalized shame that people with mental illness have about their own condition. And then institutional stigma is more systemic, involving policies of government and private organizations that intentionally or unintentionally limit opportunities for people with mental illness. And on the screen are some ways that we can break stigma: talking openly, educating yourself, showing compassion, being honest about mental health treatments, and then choosing empowerment over shame. And that goes back to that strength-based versus deficit-based thinking. And yeah, we are now moving on to an activity, and I will allow Tanya to take back over.
Thank you, Michelle. So as we mentioned in the beginning, we'll be providing you with the opportunity now to collaborate and share out with other LEAs what you're doing with your program, and maybe share ideas and things like that. But before we do that, I'd like to have everybody please think about everything that we've just kind of presented on and talked about, and take a couple of minutes to organize your thoughts, and then drop into the chat one or more strengths from your existing mental health screening program, and at least 2 areas needing improvement that you've identified from what we've been discussing today. You will need to provide these on the quiz that we've asked you to take to verify your attendance for today. So I'm just going to give you a couple of minutes to sort of think about these things, one or more strengths, and at least 2 areas needing improvement. And then once you have those kind of thought out, then feel free to drop those in the chat. And then I'd like to, after that, again, open up the opportunity for some collaborative sharing. So we're just going to take a few minutes to let you do that. I'm starting to see some people already put some things in the chat. Thank you very much. So Karen shares that they have a mental health therapist who does some of the screening. McKinley, are you referring to me? Is your question for Scott and Michelle and I? Jason states that they use the Hope Squad, like an effective screening tool. Zach says they have 15 mental health specialists hired and offering services to students. And they need to work on, they haven't performed their screenings yet, so they still have some learning to do. Karen says that a weakness is that they need consistently used screeners for kids who are not emergencies. Carrie says, I think one of our biggest strengths is that we have a robust counseling department and school and referral process already well in place. Very good. Sheila says we have a wonderful social worker who screens for us. McKinley's asking Scott and Michelle and I to share the strengths of our program and 2 areas needing improvement. Well, I'll have to think about that.
Tanya, let me weigh in. I will
Go ahead.
share an area of improvement when I was in this work. We found out in the program that we were working in that we didn't do a great job of warm handoffs. And so the front end screening process was taking place. We felt good about it, and even establishing some level of trust with that family during their time in the program that I was with. However, really making sure that we were connecting them in a meaningful way and assuring that that level of trust was being extended to their next step, the next touch in their lives in treatment, was a place that we were falling short. So that was an area of improvement that we ran into for sure.
Awesome. I think for the program that I was working in, what we did very well was assess risks, right? Like Michelle was talking about, we were really good at assessing the risks, but what we needed to improve was how to assess those protective factors, how to look at the student and the family from a strength-based perspective and identify how we could build those strengths and those protective factors so that we could prevent further issues from happening in the future. So that is something that I would say we've known about for some time, but we have yet to be able to really operationalize. I see lots of share outs in the chat, so thank you so much. Let's see, Sheila says we have school counselors, social workers, and psychologists that work well together, determining a plan and surveys to access student risk factors. Paula says we use our counselors to screen, but excited to use a universal screener. Very good. Continue to put these things into the chat. I really appreciate it. And then keep those things in mind so that you'll have them accessible to you when you're doing the attendance and quiz verification for today. I'd like to now, I did ask a few LEAs in the chat earlier. I'm not sure if they saw my chat to them. I asked a couple of LEAs if they would be willing to share out some of their lessons learned. And I'm wondering, Kurt Jenkins, I'm wondering if you saw that message to you, and as well as Rebecca Anderson. And if you'd be willing, I'd love it if you could just open up your mics and share some of the lessons you've learned. You could open up your mic.
Okay, I've got Debbie here, Debbie Reese. So here, I'll share our video so I know you all want to see us. We're all concerned. So, so this is our, third year doing, so we've learned a few things, but I'm gonna let Debbie tell you some of the things that we learned with that.
Oh, thank you for putting me on the spot. What we've learned that it's really important to involve our community partners. We work with Bear River Mental Health, but we also, pre-COVID, were able to bring in other partners and have them there to meet with families. For example, we had CAPSA and the Family Place and the Health Department all available to provide additional resources. We also learned that it was important to have the school counselor at the screening for the students so that they could be introduced to the counselor, the mental health counselor that would be at their school. What else?
But that might need to change.
Yes.
I think we did services in both English and Spanish, so that was helpful. Bear River, in their survey, their screener survey that they send out, have started to include some resilient questions on there, just so that there's a place to speak from.
Yes. That was good.
And is that good enough?
That end.
Yeah, thank you so much for doing that. I'm sorry to put you on the spot. I was hoping that you saw that.
No, there were so many messages. I must have missed that. Sorry.
Rebecca, would you be willing to share out some of your lessons learned in Alpine?
Absolutely. And yeah, I didn't see your direct message either. Sorry. So probably lessons learned most of all are to make sure that we approach it in a way that we're not overloading our counselors, our service providers overall. So generally what we do is we have parents access a QR code that leads them to an information form that gives us the information needed for the screening instrument that we use. And then from there, it takes them to a time slot kind of form so that we are managing how many students are coming. And this has actually been really useful as well for COVID numbers control with that. But we don't want to overload our service providers with having more students than we can handle at one screening event. So we're pretty systematic in how we approach the event itself. What we have found that works really great after the students participate in the screener, they meet with their parent and a service provider. Generally, it's the counselor that they work with in the alphabet that they are in, and they meet with them for about 15 minutes post screener. And the tool that we use gives a readout right away. It's real time. And so they can go over the results with the parent right there and talk about any concerns, create a safety plan if it's necessary. But most of all, it's just been really helpful to have parents just see the positive things that their students, because we do a lot of resiliency kind of questions as well, determining how those characteristics that the student already has, and it helps them see how they have some really positive things in place already and how to just tap into their strengths. So hopefully that answered your question.
Yes, it did. Excellent. Thank you so much. I really appreciate you guys being willing to do that on the spot. So I just want to open this up now for a few minutes if LEAs want to ask questions to each other and collaborate with your peers around how this program works. You've heard kind of some talk about mental health screening nights, and that is how many of the LEAs are operationalizing these mental health screenings. But there are other ways and methods as well. So if you want to discuss that or any other questions you might have for your peers who are actually doing this work, I'd like to just provide you with that opportunity now. And then after that, we'll do resources, and then we'll answer your questions. So go ahead and feel free to open up your mics and have that ask any questions or discussions of your peers.
Tanya, are you considered our peer?
Sure.
Okay, I have actually a couple of questions. So one of the things that we've done with our contracting services with Bear River Mental Health is we have done we've assisted them in the surveys, the screening surveys, and then they meet. We set up the appointments for them, and we provide either a location at one of our places for their therapists, or they can go online. But so two questions I had. 18-year-olds, so their policy, I guess, is if they're 18 years old, they can certainly be involved in a screener. So is that, how do we work? I mean, that's a little different when we're looking at, I mean, on a school end versus their end, they're classified as independent. So
do you have a contract with Bear River that talks about how they will deliver the service?
You know what? We have a contract with them, but it's inclusive of all of our mental health stuff. It's not specific to the screener. So,
okay. So
is that something, if we did just the contract with them and specified how things were done, would that solve that problem?
Yes, I think that that should definitely be written into their contract, that it's an expectation, and it's because that is that has been the legal interpretation given to us that all students, if they're still in school, and because you're involved as the LEA, providing support and resources for those mental health screeners, and they're done with your knowledge and approval and through the process of getting parental consent and all of that, that in the contract, you need to specify with them that even though the student may be 18 or above, that they'll still need to make sure to get that parental consent. Does that make sense?
Yes. And then the other thing that we have is, oh, what was it? That made me think about it. I'll come back to it. I'm sure somebody
Okay.
has something for you.
I think it's the same question that I have. We have a lot of parents that will come with their student just out of the blue to a screener that they either heard from a neighbor or something, and show up to the screener without that 8-week parental consent. So what do we do with walk-ins?
So the 8-week, I saw some of the questions in the chat about that. The 8-week is just, it just means that within 8 weeks, there's an 8-week time span prior to the
I
screening.
read that wrong or heard
Yeah.
it wrong. Yeah.
You have to have parental consent within that 8-week time frame. It can't be after, and it can't be more than 8 weeks. So as long as it's within that 8-week time frame, you're okay. So if it's the same day of the screening, you're also still okay, as long as it's the parental consent is signed prior to the mental health screening happening.
Thank you.
Okay.
Yes.
So, and the other question on parental consent. So the screenings are actually done online with a survey with a consent box on that for parents to put on that. So, I mean, that helps us, especially since nobody can come in pretty much in person anymore these days. I imagine that's still fine. And if in the contract, we have something where Bear River will make contact or with parents that they can complete, they can share information with the school counselor, right?
That's correct.
Okay, all right.
As the statute, as you saw in that language of the statute, it said that they could share the information with the multidisciplinary team from the school, and that includes anyone that you designate that they can share that information with.
Okay,
So.
all right, sounds good. All right. Oh, yeah, never mind.
So as some of the rest of you have been hearing this discussion, please again feel free to open your mics and ask questions of those of other LEAs about how they handle specific issues or concerns, or how they handle these specific requirements, how they operationalize them. Please feel free to do that right now. And if there's not any questions, then we'll go ahead and move on. Okay, I'm not seeing or hearing any questions, and I want to make sure that I give you that opportunity. So if you think of something after today's training and you want to connect with an LEA who's been maybe a little bit more experienced at doing this work, please feel free to reach out to us and we'll refer you to a couple of LEAs that you can speak with.
Excuse me.
Yes.
I had a question. I just barely got my mic working.
Sure.
This is
Go ahead.
fun. I was wondering about the release, the consent form in the 8 weeks, if there could be some clarification on, is it just on that? I just had read some things on the chat, so.
Yeah. So again, it just means that within the 8-week period prior to the screening, that's when the parental consent form needs to be signed. So it just gives you a 2-month leeway. So say you're planning a mental health screening night for 2 months out. If you want to release the sign-up sheet for parents, you can also do the parental consent forms at the same time. It just gives you a 2-month leeway where you can get the parental consent form signed from the parent. It doesn't mean that you have to do it 8 weeks prior to the screening. It just means you have that whole time from 8 weeks prior to the screening to the actual screening occurring to get those parental consent forms signed.
Hi, I have a follow-up question to that.
Okay.
So I work in the school as an LCSW. And so we have our own set of consent forms that we have parents sign before we can meet with students. So is this 8-week window, does that now mean that we only have the 8 weeks in which we can evaluate those, even though they've signed a different explicit set of consent forms as for the therapist within the school?
Yeah, so it really depends on if you're what it is that you're actually doing with the student. So again, you need to remember the difference between screening and assessment. So what I'm hearing you talk about is more assessment. You have a student who has an identified concern, and the social worker wants to sit down and meet with the student to talk through those concerns. Is that what you're kind of referring to?
Yes.
Yeah, so that's considered an assessment. A screener is really, it's a universal opportunity for any student or the parents of a student to come in and have their student screened for the possible presence of a mental health issue. So they're two different things. If you're going straight to an assessment with the student, then you're effectively skipping over the screening process and already identifying a concern. So they would have to be two different parental consent procedures.
Perfect.
One
Thank
for
you.
the assessment and then one for the screening.
Thank you. That was much better.
Ultimately, the goal is to have every student screened. Is that correct?
That would be up to the LEA. I mean, in my opinion, yes, that would be the ultimate goal. It would be best practice. That's why we've been talking about, we're trying to prevent these things from getting any more problematic, right, for students. So, but it's really up to the LEA if you want to start small and just start with specific grades or specific classes, or even just with one school. That's up to the LEA. So.
I had a quick follow-up question to the 8 weeks. If we screen them in the fall and then we rescreen, parents have to probably do a second because it's past the 8 weeks.
Yes, correct.
Great. Just want to make sure we cover our bases.
So on this slide, and we're going to be posting the PowerPoint so that you can have access to it. On this slide are resources that we've utilized in today's presentation, and they're all hyperlinked to the websites where you can get more information. And then, oops, I don't know what, I probably just clicked on one of them. If there's any more questions, I'd love to do that. And we've also been keeping the questions on a separate document so we can make sure that we're answering. Can you guys see this questions asked? Yes. Okay, so I'm gonna go through these questions and make sure to get all of them answered for you. So yeah, I just answered. The slides will be available for you. We'll be posting those on the USBE website. The training is recorded. Oh, it's asking if it can go towards your hours. And I'm not sure that we discussed that. Scott, Michelle, maybe Christy, if you're on the line. I don't know the answer to that question, but we can certainly find out and make sure that if the answer is yes to that, we can, if once you sign that attendance, go to that attendance link and take the quiz and sign your name that you attended today's training, we can talk about how to get you those training hours. So the first two and last requirements on slide 12. Let me go to slide 12. So the participation application, the pre-approved screener, and the comply with data privacy and parental consent requirements are for all LEAs implementing mental health screening, but the others are for mental health screening grantees. No, all of the requirements that we went over today are for all LEAs that are conducting mental health screening. So everything that we discussed, whether or not you're a grantee, you still have to comply with these requirements. So if you have any other questions about that, please feel free to open your mic and ask. Is there a list of specific data that needs to be collected and reported on your website, or can that be sent? We can definitely send that out. One of the slides that we went over has what's specifically stated in the statute. I think as a team, we've kind of met to discuss that there may be a few additional data items, but we don't want to make this overwhelming for LEAs, and we don't want to put a whole bunch of requirements in place, especially at this time of COVID. So just know that any data reporting requirements are going to mostly stick to the things in the statute, and maybe a couple of other items that we'll need in order to build our case for continued, possibly increased funding for this for this mental health screening process. Let's see. If I use a screener as a school counselor with a student who may have suicidal ideation, do I need to first contact the parent before using the screener, even though it is a crisis? Or could I just have it listed as a screener that we use and have the parent sign that at registration? So I'm not, the thing about the crisis situations is, again, it doesn't fall under this mental health screening statute, but we do highly recommend that you make sure to work with your attorneys, your LEA attorneys, so that you make sure that you're following the parental consent procedures for that kind of a process or issue. Scott, do you have any further insight? Okay, he says no, that you want to add to that. Just make sure that you're consulting with your attorneys. And then if you would like, or maybe Michelle, if you're still on, do you know any other further information to help out these folks on screening for suicidal ideation in the crisis moment? Or maybe we can get Kathy Davis to help us answer this question for you. Okay, number 6, for parental consent. If you're partnering with a local mental health agency, does the 8 weeks still apply, and does that apply to 18-year-olds? I think we've answered that, but again, just to clarify, yes, the 8 weeks still does apply, and yes, they still need to get parental consent signed for 18-year-olds. If a student poses a threat to the school, again, that's crisis assessment, or that's a crisis screening, so you'll need to follow the procedure outlined for that. I believe that there is a specific procedure set forth in statute that states that you can get parental permission after, as soon as you can after the crisis, but you still have to get parental consent. Okay, I use a pre-post test for small groups that ask specifically about anxiety. I have parental consent for them to participate in the group, but that specific pre-test isn't listed on the screening tool list. Doesn't need to be. Interesting question. I believe that the answer would be yes to this. Because you're screening for the possible presence of anxiety. So you might want to either change that to use one of the screeners on the approved list, or maybe give us a call and we can help talk you through that process. Do you have anything to add to that, Scott?
Yeah, I feel like, that's one of these one-off unique situations that within a survey, pre and post-test survey, what do those questions look like, and how can we apply those? We would have to look at that, and I believe, Tanya, what you're saying is correct. If it falls in the realm of what is considered a mental health screener, we'd have to apply the rule to that. And so we would have to look at that, and we're happy to.
Yep.
Can I ask a follow-up to that?
Sure.
So and somebody else brought this up in the chat as well. Wouldn't it, at that point, they've already been identified as someone who could benefit from the group? So wouldn't it at that point become an assessment because it's treatment?
Yeah, I would feel most comfortable if we could, if you could give us a call and we could talk through that situation with you. I just think we have way too many questions about that.
That's going to be a relevant question for a lot of school counselors, and you're going to have a lot of different assessments to look over if they're required to be on that list.
Yeah,
so.
that's good. And we knew that that would probably be the case. And the thing about it is, if we can get clarity on the specific issue for you, and then we can post that information on the FAQ document for others who might have the same question. Does that make sense?
Okay.
So, yeah. So if you want to reach out to Scott or I by email, and then we'll schedule a follow-up conversation with you about that. Okay, 8, how would I find board approved screenings? That is listed on the Safe and Healthy Schools website. There's a link to the school-based mental health, and it says school-based mental health screening. And on that screening tab is the list of board approved screener tools. And we'll provide you with that link as well. You can find the link. It's embedded in the PowerPoint. So when we post the PowerPoint, you'll be able to click on it and get to that directly to that link. When will funds be released to schools? I believe that for those that have applied for the grant funds, I have already heard that they've been approved for the grant, that those funds have already been released to you, but I'm going to need to defer to Christy or Tina for that question. And there were a few, just for everyone on the line, there were a few applications that we needed some additional information on, and I followed up with those LEAs, but I still need information from a few of them in order to approve the grant. So let's see, and I'll follow up with those LEAs. I would also like to know the pre-post test. Okay, so for anybody who has this situation for the pre-post test during treatment groups, please reach out to Scott and I, and we'll talk through those with you. Can the money be used to support what the screener data shows is a need, or is it only for the screener and data collection? I believe that yes, the grant money could be used to support, again, reimbursement for parents who don't have the ability to otherwise access those resources. So the two approved uses of the grant funding is to support your mental health screening or to provide reimbursement to parents. Hopefully that answers that question, but if you have a more specific question about that, please feel free to reach out to me. I'm not sure what, it wouldn't work at registration except for the first couple of months. Okay, if you have, again, if you have more questions about the 8-week time period, please feel free to open up your mic and ask. And the last one is, would it not be considered an assessment since they have already been identified for the group? Yeah, so that's something, again, that we would like to discuss with you individually. That's a lot. Okay, are there any other questions that Scott or I can address for you before we end? Again, I just want to remind you to go to the link. We've posted it several times in the chat, and it will also be posted on the website because we have people who have expressed that they weren't able to be here today. So this link will be posted on the website. Make sure you go here, fill out your attendance, and then answer the content questions in order to verify your attendance for today's training. And again, the reason for this is this training was required by both board rule and statute. So we need to verify that all LEAs conducting mental health screenings have attended this training today. And then one last thing I wanted to show to you again is this FAQ document, which has a wealth of knowledge and information and things that we've learned and legal interpretations that we've had to get as questions have come in from you on how to implement the screening process. And with that, I think that's all. Scott or Michelle, is there anything you want to add?
No, Tanya, I think you've done a great job, and thank you, everyone. Again, like I said earlier, this is difficult work at times, and I appreciate your willingness to engage in it. It really will make a difference in the lives of our students. So thank you for being here.
Yes, I thank you so much for your attendance today. Michelle, do you have anything you want to add before we go? No, she says no. Okay, well, thank you so much. And we're going to stick around for a couple minutes in case you have any other remaining questions. And other than that, we're done for the day, and we're getting you out of here and giving you 20 minutes of your time back. And hopefully that's a good thing for you. So have a wonderful day.
Hey, Tanya, this is Kurt
Yes.
again. Sorry, I always have a million questions.
That's okay.
So before you were talking about the goal, I guess, was to do a screening for all students. But before that happens, shouldn't schools have a universal care process in place? Because once you start screening and you've manifested suicidal ideation, you have to provide either treatment or care for those students. Some schools, if they take on too much, may not have that ability to do that.
Yes, absolutely. As Scott and Michelle kind of talked about, best practices to make sure that you have that scaffolding in place, those resources in place so that you can provide that support to students and their families as we do the screenings and those results, we get to know those results. And so again, as we talk about universal screening, it's the opportunity is offered to students. And again, the LEA has the ability to decide what that means. So you can kind of tailor your screenings like Rebecca was talking about to make sure that you're not overwhelming your system or the resources that you have identified that can provide that support for students. So yeah, just be aware of those issues as you're implementing your screenings, that you are strategic and you think through how many students would we be able to provide support at this time, and so you're not overwhelming your partners.
Okay, perfect. All right, thank you.
Maybe I can also add, just on from a scalability standpoint, sometimes this feels overwhelming. And for schools, especially when it's not necessarily their level of expertise, this isn't their world, to have maybe 3 really distinct levels of potential interventions that may be one universal, to the school if we see that there's a high risk or potential risk being learned from universal type screening approaches. What is it that we can do on a universal basis to help support that? Those things may be appropriate interventions for some indicators. Also, what can we do on a step up from that within our ranks of our schools, within our employees, within our district? What do we have? What does that look like? And how do we connect those youth that are maybe showing some needs, and we can meet those with that resource? And then finally, the community, and that's where the partners come in. What exceeds outside? When do we know that we need to really move beyond what we're currently able to handle on our own? And so really coming into the space, knowing that there's going to be identified needs, not necessarily all of those needs will require intervention, but that some type of response, even if it is a universal response to help improve school climate or social emotional learning or adjust with staffing or however that looks, may be appropriate in some cases.
All right, thank you. Thanks, guys.
No, thank you. Okay, we're just gonna stick around again if there's any more questions, but if not, feel free to exit and enjoy the rest of your day. And I hope you have a wonderful weekend.